Joining us, epidemiologist and infectious disease specialist Anne Rimoin. She is a professor and director of the Center for Global Health Security at UCLA's Fielding School for Public Health. Anne, it's really good to see you. It's been a minute. What should we make of this cruise ship and the infections and the deaths and the potential transmission?
Well, Katie, thanks for having me. And, I think that this is a very important and complicated moment. When you ask me what do we make of it, we live in an interconnected world where infections that emerge in particular at this animal-human interface can quickly become an international public health event, especially when travel is involved. A cruise ship is a contained environment, but we know that diseases can spread very quickly on a cruise ship. So it's a very complicated situation that's going to involve a lot of different jurisdictions, a lot of good public health epidemiology and outbreak investigation that's going to span continents.
Can you quarantine effectively? I know a lot of people, when they see this, they have PTSD from COVID and the cruise ships and the initial stages of COVID. So can you effectively quarantine and get these people off the ships, but also keep this from spreading?
Absolutely. I want to make it really clear. This is not another COVID that we're looking at. This is a hantavirus. Hantaviruses are very different. Most hantaviruses are really spread from contact with rodent urine and saliva and droppings. The Andes hantavirus, which is implicated here, does have some evidence of being able to be spread from person to person, but it seems that this is a very unusual and very specific circumstance where you had people who were infected in potentially, as we assume at this point, because we don't have all the information, in Argentina, were on this ship. And certainly with close contact on a ship, you can imagine that there would be opportunities for spread. The question is how easily does it spread? What are the mechanisms? And where are all the other people who got off the ship already? And I think that those pieces are coming together very quickly. But I really want to emphasize that this is not a typically respiratory pathogen that we think of with COVID.
So why all the extreme care being taken if it's not a COVID and if it is something that it should be easier to track because of the transmission? Why are these folks still trapped on the ship?
Well, low public risk does not mean low consequence for the people that are on that ship. I think that that's really important for us to understand. And you also have to understand we need to be able to talk about things like these, an incident like this, where we're seeing disease spillover, people affected. It's certainly dramatic for the people on the ship, but we need to be able to talk about these things and to be able to get to the bottom of them and understand that we should be concerned, but not necessarily panicked here. This is where public health and public health coordination globally really matters. We do have outbreaks happen all the time. It's just a matter of how quickly we can get in front of them and we understand what's happening. That's why disease surveillance, that's why public health and global public health is so critical.
Should we be concerned about what happened at the CDC? It shuttered its vessel sanitation program. These are the cruise ship inspectors, getting rid of the agencies who normally would be investigating and tracking this stuff. Should that worry us?
Well, of course. We are less prepared for an event just like this when we weaken our public health infrastructure. This is exactly the kind of scenario that the CDC program was funded for. It's the exact scenario that our public health departments are funded for, and why science related to infectious diseases is so critical. As you know, I work in emerging infectious diseases, and this is a perfect example. We have a little bit of data on this particular Andes virus, but it's not extensive. And it's not because people aren't interested, but it's just that funding for this kind of work is not plentiful. And so we work with the information that we have, and then when we have a big event like this is when the information speeds up, because all of a sudden we have reason to do so.
All right. Dr. Anne Rimoin, epidemiologist, thank you as always for being here. And it's really good to see you. It's been a minute.